Welcome back. This is Dr. Eric Roden, physical therapist at Neurology Solutions. Today we're going to go over a tutorial on how to do the half kneeling hip flexor stretch. If you are one of my patients, this is a common stretch I give you as long as you don't have any severe knee issues. You can also put padding underneath the knee to help out with that if needed. But the reason I like this is because it's multifaceted, it actually gets a little bit of balance, and it's a great stretch for opening up these hips. So you want to get in this half kneeling position. If it's hard for you to balance, you're welcome to put a chair down. I recommend it on this side with your forward leg because we're going to be utilizing this arm. I'm up at a 90 degrees, so I'm straight up and down on this arm with a 90-degree bend on this leg here. Now, the key with this is going to be basically the butt tuck. So you want to tuck your tailbone underneath you. So you can see my hips. If I'm arched this way, I'm going to arch completely out of the way. That's called a posterior tilt of your pelvis. So I want to posteriorly tilt that pelvis. And now I'm already feel stretch, but I want a little more intensity. I'm going to shift even further forward, and I'm going to feel really nice tension through this back leg. Now, there's a couple different variations of this stretch. This is the most simple, where your arms are relaxed or holding on to something. A few variations, you can now add in the arm overhead, reaching as tall as you can. That way you're bringing in a little bit more abdominals, those basically those muscles between the ribs, and even into the lats. So you're really opening up that whole side, think big and tall. Variation 2, you can actually add a side bend, really open it up. That might change the stretch down in the thigh. You might feel that a little bit more lateral. That is totally fine. And come back out. Then the third variation is you can actually slightly internally rotate that hip. So what that does, basically, you're taking the heel and you're bringing it further away from you. Just a little bit, not end range. Do the butt tuck, shift the weight, and again, coming up tall. Just basically 3 or 4 variations that can help you address tightness in the front of that thigh, which is a common area for rigidity and tension, especially if you're sitting a lot, at the computer a lot. Definitely something you want to do routinely. Thank you for joining us. We'll see you next time.